Namaste. I am Dr. Vishal Rao here, a part of the Indian Cancer Society's team to raise awareness on the nutritional aspects of cancer today. Very often when a patient sits before me and asks, showing me his PET scan report, sometimes it's an advanced stage, stage 4. I show it to them and I tell them, look, maybe 10% of the body comprises of the tumor, but the 90% is still the good cells and the immune system. Have you forgotten about it? Often in my conversation with these patients, I ask them, do you know which chemotherapy drug you are taking? Do you know the name of the drug? Do you know the dosage of the drug? And they seem looking completely blank. It's as though they've outsourced the body and they don't know and they're not interested to know because somebody else is treating them. But in this I ask them, what is your level of participation? How do you participate in your cancer treatment? And that comprises of 90% of it. And that has an integral 3 parts to it: the water and the nutrition you take, the food and the oxygen. Now it is well known that in the presence of oxygen the cancer cells can't grow. So every patient I encourage to do a simple practice of yoga, pranayama, breathing exercises that slows down and improves the oxygenation to your cells and gives it a number of revitalization. Second is water. It is one of the best detoxifying agent for the body. Take plenty of fluids if there is no advice of restriction of fluid from your physician. Third part is food and nutrition. Diet is something that you take for the taste, whereas nutrition, that is something that is required for the body. Oftentimes we tend to neglect the 90% which lives on nutrition. This requires a good balanced diet. Now it is often known that cancer cells live on sugar. So avoiding very high tasty sugars is the one that can be detrimental to the immune system and to the cancer cells to help them grow metabolically. So we often advise patients that while sugars are important, talk to your dietitian, have a balanced diet, complex sugars, proteins, vitamins, minerals, fats, fibers. Fibers are a very valuable component also in this diet. Now this is the aspect of nutrition that you should focus on every day during your cancer treatment. It is as important as saying that food should become medicine and not medicine becoming your food. Oftentimes when people ask me, after this what should I take for medication in cancer, I tell them good food, because the power and the impact of good food can be as powerful as any good medicine. So please note this, that even after you are cured of cancer or during your treatment of cancer, ensure that you are taking your nutrition very meticulously. Indian Cancer Society, they are supporting BPL category patients today and doing a humane job to reach out to people to help reiterate the simple point of nutrition, which is more powerful than any big chemotherapy drug or immunotherapy drug or any surgery or any big radiation machine. Please help us spread this simple message of nutrition, which is more powerful than any of these tools that put together. And in this effort, I would like to reiterate to say that if there is a breakage in your nutrition somewhere, consult your nutritionalist or dietitian. Ask them for other alternatives, semi-solids, solids, if you can't take semi-solids, liquids. There are methods in which your speech and swallow team can actually help you rehabilitate that. Your diet and nutrition team can support that. We run very nice comprehensive rehab programs and most cancer centers run it. Rehabilitation is important. Nutrition is very, very vital for this. Do not neglect it. If you have missed out on your nutrition, the total number of calories for more than 24-48 hours, do not neglect it. Reach out to your clinician and take support. Namaste.